Fiber optic endoscopic evaluation of swallowing, known as FEES, is today's gold standard for instrumentally evaluating the swallowing function. This exam is done by a trained and licensed speech-language pathologist at the patient's bedside in order to adequately assess the physiology of the swallow, enabling full view of the structures in any position in all settings. It requires no patient transportation and no radiation. The first part of a flexible endoscope is gently guided along the floor of the nose and stops above throat, where a bird's eye view allows an examination of the base of tongue, epiglottis, arytenoids, vocal folds, and proximal esophagus, where evidence of any backflow is seen. LPR is seen in almost 50% of dysphagic individuals. Food and liquid are often colored green. Carbonated beverages can also be tested because barium is not used. With aspiration pneumonia being one of the leading causes of death in nursing facilities and one of the top 5 reasons for 30-day rehospitalization, FEES is the optimal means to assess the swallow when dysphagia is suspected. Not doing an instrumental exam can be very costly to a facility and to a person's life. Other means include the clinical swallow evaluation and the video fluoroscopy. The clinical swallow evaluation is 70% inaccurate. Even the best clinicians have no way of knowing if it's reflux, if the complaint of pain is due to thrush, if the cough is from the drink just taken or from buildup of residue from previous bites, if the person is silently aspirating, or what strategies to implement. Clinical swallow evaluations only allow us to suspect the pathophysiology of the pharyngeal phase of the swallow. We can only form a hypothesis. Video fluoroscopes have their value. However, remember, they are equivalent to 25 chest x-rays. They must use barium, they do not allow for testing carbonated beverages, and aspiration of barium is toxic to the lungs. FEES is reimbursable to insurances. It yields a specific plan of treatment. Nursing staff are encouraged to view the exam for education and better carryover recommendations. All exams are scheduled within 1 week of the doctor's orders. Easy on the patient, no transportation, affordable, and clinically the optimal choice. Call Northeast Mobile Swallow and Speech Services or go to swallowingdisorders.com.